Mental health is one of those topics that people get wrong all the time. There's a lot of assumptions about it. There's a lot of misconceptions about it. So the first thing we need to do is start with a definition. Actually, what is mental health? What do we mean when we talk about mental health? There's a few definitions out there. Some of them are better than others. So we'll start essentially at the top. We'll start with the World Health Organization. In 2018, they released a report which included this definition of mental health. It's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Realistically, I think that's what everybody wants. They want to be able to live up to their own abilities. They want to be able to cope with their own stress, work productively, and make a contribution to their own community. Unfortunately, that definition doesn't help us very much in terms of understanding what mental health is. That's kind of what mental health means, or that's what it does. But what it actually is a little bit more tricky than that. The simple way to remember it is that mental health is a balance between our psychological, our emotional, and our social well-being. Those three things work together to make a mentally healthy person. So what that means basically is the way that we think, the way that we feel, and the way that we interact with other people. So in terms of psychological well-being, we're thinking about how we make decisions, how we perceive the world. When somebody sees something, do they see the same thing that everybody else is seeing? Do you see a red car? Do you see a blue bag? And when you see those things, would you make similar decisions? Somebody with impaired psychological well-being may well see or hear things which aren't there. Emotionally, we're looking for how people regulate their emotions. Everybody gets happy, everybody gets sad, everybody gets angry. There's lots of human emotions out there. It's very normal to feel sad for a small period of time. What we're looking for is somebody who can't regulate that, who is unable to sort of move away from feeling sad into happy. Clearly, when we see someone who is very sad a lot of the time, we would describe them as having depressed tendencies. However, if we see someone who is very happy all the time and unaffected by the things going on around them, then that can also be a problem. And lastly, social well-being. And this talks about how we interact with each other. How do we communicate with one another? It's tempting here to think that people who are introverted, people who like to spend time by themselves, don't have a good level of social well-being, and that's just not true. Some people feel like their energy is boosted by other people. Some people feel like it's drained. That's very normal. What we're looking for is somebody who is unable to interact with other people, who is unable to communicate. The way that they communicate isn't constructive. They're not able to accurately portray their own thoughts, their own ideas, and they're not able to take those things on board themselves. You can see now why the pandemic was so difficult for a lot of people. Those who weren't working, who were on furlough, for example, were very isolated for long periods of time. And that is very damaging to people's mental health.